well, right now we want to welcome back Dr. Tiff Siragusa. We love when you're here. And you've come on Local on 2 to talk about veins before.
Right.
But today we are talking about something a little different. These are veins that affect the face.
Right, yeah.
Varicose and spider veins. Now, if we've seen it in bad movies, it's usually a bad guy, you know, when he gets irritated and that vein pops out of the forehead to, you know, highlight
That's how you know you're
struggle.
in trouble.
Yeah, exactly. Okay, we got to know, are they a sign of a problem?
No, so these veins that tend to stick out or pop out on the face, only a cosmetic problem. They can't cause any other issues as far as health goes, no blood clots, no pain, anything like that.
Okay. Good,
Yeah.
phew. Okay, and because a lot of people get them.
Right.
It's, yeah, that's a toughie. So, okay, there are a few different kinds, and you treat them at your center, and I'd love for you to walk us through some of the before and afters that we have and kind of explain them.
Yeah, sure. So the first type of vein we'll talk about is what you mentioned initially, the bulging forehead veins. And those typically occur as a V pattern coming down on each side of the forehead.
Oh, I
And
see
then
it right
yeah,
there.
and then kind of converge towards the nose.
Okay.
And those typically occur when people smile for selfies or photos because you're holding your breath when you're smiling. That increases the pressure and pushes all this blood up.
Interesting.
Yeah, and so the way that we take care of that is based on the fact that there's so many veins in the face that drain blood back to the heart.
Yeah.
We have so many extra veins. This one here that sticks out, we do just fine without it. And the way that we treat it, the visible portion of it, we inject a medicine into it that irritates the vein, causes it to seal off on itself, shunting the blood through other normal veins. And over about 2 weeks, this turns into some scar tissue, and the result is a flat forehead, whether you're smiling or not.
Like it was never even there.
I know.
Yeah.
I mean, I can only imagine what this patient felt like.
She was pretty happy. She actually traveled from Chicago to get this done. Forehead veins are not treated very widely as of yet. There are not a lot of places that do that. So we've been seeing people from all over the country, really.
Gotta look good for the selfie, right?
Yes.
Okay, moving on. What are the other types of veins that we're looking at?
Yeah, so another type of vein, which is similar to the forehead vein, is what we call a temple vein or an under eye vein. And these veins are very visible because the skin in this area is so thin, so the veins tend to pop out a little bit more easily there than anywhere else in the face. And these are treated in a similar manner. We inject a medicine into them that turns them into scar tissue, and they just fade and blend into the skin.
That's amazing. We were talking a minute ago about Botox. Do you find that sometimes when people relax their faces, the veins become more obvious?
Yeah, so as you get rid of certain blemishes, now your eye tends to focus on other things that you really didn't notice before because it really wasn't what you were focused on.
Yeah.
Okay.
I have a muscle that does that I never knew existed until I got a little Botox, and then all of a sudden the muscle was all I could see.
If you give a mouse a cookie. Okay, last one, and this is really interesting.
Yeah.
It's a good visual. Okay, what is this? What's happening?
So some people tend to get pigmented lesions, so like brown spots on their face from sun exposure. Others get broken capillaries like this. So this patient, he has very fair skin, and fair-skinned people, this is much more common to get these broken capillaries or spider veins on the nose, typically in the cheeks as well. These are much smaller veins, and you don't really have to inject these. These we treat with the laser.
Wow.
Yeah, the way the laser works is it heats little spots of blood up in the vein, and as the blood heats up, it literally turns into steam bubbles, and those steam bubbles injure the vein, it seals off on itself instantly. So it's the same overall end result, which is that you're closing the vein down. It's just through a different mechanism.
Very
It's phenomenal. It's like magical, like a magic eraser.
Yeah.
Just takes them away.
And you said it has a lot to do with sun exposure, perhaps driving your left side of your face.
Exactly. A lot of people with different dermatological problems have more skin cancers on the left side, more facial cancers on the left side, and more sun damage in general. On that left side.
Other than sun, and obviously coming to you to fix the issue, is there anything else people can do to prevent facial veins?
No, it's more genetic, and people are going to develop. You can't really wear compression stocking on your face.
You could try.
Yeah, it wouldn't work.
Thank you so much.
Thank you.
Really,
Yes.
really
Yes.
interesting. Well, you should find out more information and check out this amazing deal that they have going on. You can buy one, get one free laser treatment for facial spider veins. You can call or text now, 615-510-6706. The name, Siragusa Vein and Laser.
And plus, you can make an appointment and check out their treatments that we just talked about. Visit NashvilleVeinCenter.com.